Hi, my name is Randy Beckett, and I'm a psychiatric nurse practitioner and a family nurse practitioner. And I'm here to talk to you today about trauma-informed care and stress management for Encounter Telehealth and the Iowa Healthcare Association. Thank you for joining me. We will have basically two parts to this presentation. First will be a brief overview, kind of introduce you to PTSD and post-traumatic stress disorder. And then we'll have an interview with a clinician who's been a clinician for 40 years and who had a very traumatic event, and talk to you and with using him through an interview about his experience and trauma. So the most important thing to become aware of are the signs and symptoms of trauma and PTSD, post-traumatic stress disorder, or what we also call a trauma-related stress, which doesn't go to a full-blown post-traumatic stress disorder. And this can occur in people in all sorts of situations, not just from combat. And for you, COVID really meets the bill of a continuous, constant stress over a period of time. And that stress can cause the symptoms of trauma. And it can be just one event that happens to you, or just the sustained stress also can cause post-traumatic stress disorder and stress-related disorders. And it's important to realize you're not alone, especially in the healthcare. Everyone has been subjected to tremendous stress over the past more than a year now, and it's very, very difficult for you. And as a result, that sustained stress can cause problems. So in my experience, related stress disorders are common in healthcare, also, of course, in the military, and in all situations. And women are more likely to experience it. And that's important for you folks because, of course, most of the people who work in long-term care are women, and you have a higher rate of stress-related disorders. But let's not forget the men, if they're involved, then they can have the same thing. So we're going to talk with a PTSD survivor who is a healthcare professional, and he's going to tell you his story about what happened when he first got out of nursing school and where he worked, and then what happened to him at the clinic he was working in after that. And he's going to talk to you about the symptoms that he had, and he's going to also talk to you about how he got help. And he still has problems today, but he's doing much better. So let me start this video. And also I want to tell you, if you want to stop after the video and kind of mull this over and absorb it, this presentation isn't meant to be a marathon. Please feel free to stop at any time. And also, listening to his story may trigger a stress response in you, some anxiety or some depression or crying. So please realize what you're experiencing and stop. You don't have to subject yourself to further trauma by listening to his story. Thank you. We'll be back on the other side.
Hi, my name is Randy Beckett, and I'm a psychiatric nurse practitioner with Encounter Telehealth. Thank you for joining us today. Today we have an interview with a healthcare worker post-traumatic stress disorder survivor. And I'd like you to meet Doctor today. He's chosen to remain anonymous, and he'll explain why. Thank you for joining us today, Doctor. It's very nice to have you. And so first of all, I wanted to ask you a question. In your experience, just as a healthcare provider, does it matter if you're a nurse or a clinical workers such as a certified nursing assistant or a surgeon or anybody in healthcare, is post-traumatic stress disorder across all roles in healthcare?
Yes, all employees and providers, prescribers in the healthcare arena will be exposed to traumatic events.
So, for example, we're talking to people in long-term care settings today, somebody in dietary or somebody in physical therapy or occupational therapy or somebody in administration. Could they also develop post-traumatic stress disorder?
Yes, provided they had an event that was so overwhelming that it made such an impression.
And we'll talk about your event. It isn't necessarily just a single one-time thing. It can be over a long period of time, sustained stress. Is that correct?
That's correct.
Okay. So for you, doctor, how long have you been in healthcare?
I've been a clinician over 40 years.
Wow, that's a long time. And so when you left working in healthcare, what was your final position? What was your specialty?
My specialty was general psychiatry with the emphasis of taking care of veterans and other family members in society that were suffering from traumatic events and known as post-traumatic stress disorder.
Okay. And I understand that one of your first position in psychiatry was in a prison?
Yes, I was director of psychiatry for a maximum security prison. And then I was in a community setting. I took care of severely ill, mentally suffering folks that had schizophrenia or bipolar or PTSD. And eventually I retired traumatically retired from a facility that specialized in post-traumatic stress disorder for folks that were actually involved in war settings.
So when you were in the prison, did you see or experience any trauma then?
Yes, on many episodes, experienced trauma from both observing it occurring to someone and also my effects of how I interpret it.
And you were in a maximum security prison as one of your settings, isn't that correct?
That's correct.
Okay, so I've never been in a maximum security prison, but I imagine there's several levels of security that you go through to get in there, and then you're in the prison itself. That seems like that in and of itself would be stressful.
Well, I was trained by an excellent forensic psychiatrist, and you have to have a lot of training to be able to go through the levels of security. Mine was that I would see them in death row or the most severely criminals of inmates of the prisons, violence, murderers, the whole gamut of.
Okay. So during your time at the prison and after prison, did you suffer any symptoms that you knew of from post-traumatic stress disorder at that time?
I didn't have episode where the salient feature was that I could not recall the event.
Okay.
So I had some features of
from the prison
anxiety, yes, and just a human being seeing violent acts.
Right. Sure. Okay. And then you worked in the community for a time, and then you went to work in another government setting. Is that
Yes.
correct? And then one day you had an event that occurred. Could you tell us about that, please?
I had a patient that was seeking narcotics, and he was calling my office and getting through to me he was demanding narcotics, and he felt like the doctors down in the internal medicine department of pain management were not aptly supplying him with his needs. And he started putting we thought, pressure on me to speak to them on his behalf, to intervene so that he could get what narcotics he wanted. And he had ramped up so much, and he was intermittent explosive disorder. And I had seen him explode on many people and had worked through dealing with the episodes and trying to engage him in therapy and not punish him.
Right. And then one day,
The tables turned, and I knew today the event, I call it the event, is that he came into the office unannounced, said he demanded to see me, and he intimidated the office staff. And apparently they made a place for him. And so I was on high alert that because of all the calls. So eventually I said, I would like to have some type of protection or enhanced sense that something could go awry here. Anyway, he came into I greeted him in the hallway. I noticed that his demeanor and his posture was very, very tense. Right? And he entered into my office with me sitting up against the wall and him sitting right next to my door. Within a second, he started yelling and screaming at me. The door's closed. The walls there are so thick. This is a brand new high-tech facility that you couldn't hear the outside.
right.
I had no security, no protective devices, no alarms. I couldn't call on the phone.
Sure.
So he started threatening, and then he stood up and started to tower over me. And I noticed that he was pursing his lips, and he was now moving toward the door. He was about 300 pounds, and he was yelling about killing another doctor downstairs to get even for not getting the narcotics. At that point, I was fearful that they was going to pull a device, a knife or a gun, and actually execute me. So I kept watching his hands. Then he barred the door and put his hands against the door and locked it, and I was confined then. After that, I don't recall anything but somehow getting out of the office. I ran from my office through an auditorium. He was in hot pursuit and was yelling and screaming and cursing that he intended on catching me and putting me in the trunk of his Cadillac, and he was going to show me then. I continued to run, and I had, again, no security. And at that point, I got to a door, and two civilians were there, and I told them to stop the individual and to alert the police. I was able to get away by closing that door and putting a barrier in between.
Wow, that sounds really intense and awful and horrifying, all those things.
It was.
So I guess for that part of your career, you had the sustained stress of the prison environment with some like one-time stressors, maybe like an event, you know,
Yes.
and then you went and then and also at that time when you were working in the setting when the man attacked you, were you working like extra hours? What was your schedule like?
My schedule was overwhelming. My practice had gone up over 60% in patient volume, and I was already busy from the year previously. And the work demand was not 8 to 5. It was until I handled all of the particular patient needs that day. So yes, I was working and I was covering other doctors. And so it was the most stressful time. Everything had to work perfectly on me in order to accommodate and keep up with the demands.
So during COVID, since we're talking to people in long-term care settings, workers have been out of the facility from illness or for, they had to go into isolation or quarantine at home. People got sick, people left, and the people that were left working because of the understaffed were kind of subjected, or not kind of, they were subjected to the same types of stress that you're describing, where you're in a very volatile situation, dealing with very sick people as you were psychiatrically, but in nursing homes and long-term care, there's people that have psychiatric problems as well. And then you're shorthanded, which you were, that's why you had to see all those patients. And then there are tragic events that occur during that time. And so the people that we're talking to today, your situation and their situation in terms of the stress that is on them and was on you seems pretty similar.
No one can handle sustained stress for long periods of time without having a reaction of some sort.
Well, what kind of reactions? I mean, you're in psychiatry. What kind of reactions did you have? Did you notice initially when this happened to you?
It occurs very subtly, in that all of a sudden I started noticing that I was acting peculiar, and I was avoiding certain people, and I had no recollection of how I got out of the room. It haunted me. It haunted me, and it continued to bother me. Eventually, I was scrubbing my driveway at 10 o'clock at night with chlorine. And my thought was to clean the driveway, but ultimately I felt dirty. I felt like I felt guilty that I was not holding up well. I did not want my staff to know that I was starting to literally unwind.
Did you try to stop thinking about it yourself, which is one of the symptoms of PTSD, of trying to avoid thinking about what happened?
The rumination of the thoughts, just continuous thoughts of feeling guilty that I was not acting or participating in normal staff activities.
So it was your fault, kind of, that of things that were happening.
You ultimately feel embarrassed that you didn't do the right thing, or to have someone notice that you're running from a patient.
Right.
And it goes against the grain of a healthcare provider. Should never ever fight with a patient.
Yes.
And perhaps maybe I did.
Right.
To get out of that room. I had to get past a locked door, a man barring it, a man that most likely was very, very strong. So yes, I felt very, very guilty. That was the most, and I let people down. I couldn't run.
And I wanted to people who are watching today that the reason a doctor has chosen to remain anonymous is not because of any stigma associated with what happened to him with post-traumatic stress disorder, but is because of his positions that he held in government agencies, that he has to maintain a certain level of confidentiality even today. So. But you shared all this, maybe not initially, you didn't share with your family the things that you were having, because how do you go home and share with your family something like that?
You can't, because again, the guilt that I didn't do the right thing, or I was too weak, I should have done more. And also that evening after the event, I went down to the police department and reported, did anyone report this event? They said, yes, we did. We put it in, we filed it in and he showed me, dropped it in the trash can.
Wow.
So at that point, I felt that no one had had seen or engaged
Or understood.
understood anything that I went through. In fact, I was back at work within 8 or 9 minutes of this event,
Oh my God.
seeing patients
Yeah.
until 6 that evening.
Mhm.
So I went home, and I slowly but surely started to have questions that were presented to me, that I called and asked to the lawyers if I could file charges against the individual. The lawyers for the organizations said, yes, you in fact had that. My superiors decided if they negotiated with me and he would not be punished, that I would not file charges, that that he would be treated, but he would be put in on a very, very restricted
So
attitude.
you don't feel like that you got the support from your organization that really would have been helpful for you.
Yes, and then it started, once that level of seeking lawyer referral, I was interviewed by superiors, police. The police indicated
Right.
to me that the chief of police, that I had some concerns that they didn't handle their jobs correctly.
Right. So they were trying to blame you then.
Well, I felt that way.
Sure.
Everything was self-effacing.
Now, one of the other symptoms besides distancing or withdrawing yourself, ruminating or like flashbacks of the event that happened, also is nightmares. Did you have any nightmares?
That was after going through a series of every day at lunch, I would have another individual come in and interview me. What happened? Tell me, please.
Reliving it over and over
Reliving
again.
over again, and not knowing why I let the guy in, how I got out.
Right.
And eventually an individual came in and said, how can a smart guy like you not know what happened?
Right.
At that point, it really hit me that I was overwhelmed.
You had some nightmares and sleep problems, though,
That
right?
night, I had the first terror nightmare I ever had in my life, where I awoke and I was being cornered by an individual trying to kill me.
And you also, during the day, had flashbacks, and it just affected your personal relationships with your wife and your family.
It affected every relationship that I had. I couldn't speak to people. I couldn't answer the phone. I couldn't talk to anyone. I couldn't remember the medications. I knew that I was very, very confused.
Right.
And I was reacting to any sound or any noise.
You were hyper vigilant, or like very, very alert of anything happening around you, you know.
And I would react violently. I would get up, I would scream. And I had at that point, the next morning, I was trying to drive to work, and I lost my way. I couldn't find the way to work. I called my wife, who runs a clinic, and they eventually was able to isolate where I was, and I was taken to the doctor there. They came out to my car, and it was such an odd thing to see people peering at me now, and I had no clue of where I was or who I was.
So you had a very severe case of PTSD. Okay.
Yes.
Now, a lot of people who are watching this could, say, well, that hasn't happened to me. But you don't have to go through all of these severe symptoms to have PTSD. There can be milder symptoms, which aren't mild when you're experiencing them, but let's say less severe, that they can't sleep, they can't find anybody to talk to, and their family that haven't gone through COVID, with people dying, they feel guilty, like they didn't do enough. They've been through the trauma trying to revive a patient perhaps, or just having people that they've taken care of for years just die or get very sick and leave. And so they could have different parts of this disorder and not have the severity of losing their way to work.
Yes, and the other thing to remember is that there's predisposed individuals that were victims of violence, childhood violence, violence, rapes, any type of cumulative effects of violence or abuse can make them much more susceptible.
So somebody who perhaps came from just a very I don't know, maybe a childhood or a family situation that was rather dysfunctional, perhaps, or had been in a bad car accident once, or saw something, or had depression or anxiety, just even mild versions of it. All these things of having to work extra hours and all the sustained, I mean, this has been going on for way over a year now, all the sustained heightened stress of just going into work. And then when you go home, you can't leave it at work because you're always thinking about it. That can lead to having symptoms that affect you on a daily basis and cause suffering.
Absolutely. For example, the workers in the nursing homes and those that would have to take a sick leave day because they saw something or they felt something that was so overwhelming. Patient died. Patient was sick. They saw the family suffering. Just the mere fact that they continued to see that presents a point where they've lost trust in telling and confiding to anyone.
Right. And having family members having to just see their other family members who are 90 years old or 80 or whatever age they are through a window, and having to talk on a phone through a window. I mean, just seeing that kind of isolation and onset of depression and anxiety and behaviors. I mean, all of that accumulates to cause some of these symptoms that we're talking about.
Any healthcare provider can be exposed to a traumatic event that can change and alter the way you cope with life.
And not just one event, but this sustained pandemic. They've been kind of right in the middle of it with, not enough PPE, and all these kinds of things that's been extremely stressful, and over even a short period of time that can cause, and this has been a long period of time, that can cause symptoms of anxiety, depression, these other things we've discussed.
And the rub is that if you don't have any support,
right,
your fellow superiors and HR departments have keen statistical facts on keeping employment injuries down, occupational injuries, that some of their employees are now out and they are being accused, or there's an attitude that they're just faking it or whatever, because you look typically normal.
So, and I would think that those are the minority of most, administrative people in any organization across the country in healthcare and in long-term care.
I certainly hope so.
Yeah, but then also those administrative people are under pressure, which also causes. So very briefly, as we wrap up, what kind of treatment did you get, and when did you seek treatment?
Once I had the episode of where I'd lost, and the best way to describe it is a computer that crashes.
Right.
You lose your sense of perspective, your short-term and long-term perspective, who you were, what you accomplished. You don't see yourself as ever being successful,
right,
in any means. And so the insidious part is that you have to seek out care. And I was fortunate to be able to get a good team of a psychiatrist and a psychologist that were instrumental in helping me to start to address the recovery.
right.
And the things that I asked him every day was, when can you help me get my mind back?
Right. So what we are at Counter Telehealth doing are offering confidential resources to the people in Iowa who work in the long-term care arena through them contacting us, and they can get psychotherapy as well as medication management through Encounter Telehealth.
It's critical.
It's critical, and there's so many people who are hesitating, but you know, I think first of all, as in terms of self-compassion, that they realize that they're struggling and that they just can't fix this magically. And then secondly, that there are literally thousands and thousands of people in the state of Iowa who work in healthcare who are also struggling with what they've gone through, and that it's normal to struggle and to have these symptoms when you've been through the kind of trauma that they've been through with the pandemic over the past year, and that it's essential that at least a initial visit with a mental health provider, that they talk and see, because they can get better. You're better.
It's crucial to restore your life as quickly as possible.
Right.
To start having a team approach of where you have a support network that understands how to treat this illness.
Right. Well, I want to thank you so much, Doctor, for sharing your experience with us today. And I want to thank you all in Iowa for watching. You've had the experience of being outside here with lawnmowers and weed eaters and blowers, and you hung in there, and thank you very much. And please call us at Encounter Telehealth for at least an initial evaluation. Thank you very much. Hi, my name is Randy Beck. Hi, my name is
So I'm sorry for that little glitch there in my presentation. So I hope you found that helpful. His circumstances were different, and the thing that happened to him, being, attacked, is different, but the underlying principles are still the same. There's a trauma. For him, he had in the prison, he had events that occurred that he witnessed, and being in the prison is stressful. And then at work, he was overworked, high pressure, covering for other people that were out, and then had this event. So you could see that in his situation, even without the man attacking him, he had the trauma there in terms of the overwork, understaffed, and stress of taking care of people with illness that y'all have all the time. Okay, so this is important as you read this slide, that to realize that it's not just an event, one time that happened. Remember also what he and I talked about is that certain people are kind of primed to have this disorder occur with sustained stress or one-time event. So if you've had any kind of previous trauma in your life, either as a child, as an adult, emotional abuse, physical abuse, sexual abuse, other stressful situations that were carried on for a sustained amount of time, you're primed for post-traumatic stress disorder or a stress disorder. So for PTSD, you have to have these symptoms. But like I said, there are other stress disorders. A re-experiencing symptom, an avoidance symptom. So re-experiencing symptom would be a flashback during the day or a nightmare. Avoidance is where you avoid thinking about it, or you avoid other people, arousal and reactivity symptoms, where you are what we call hypervigilant, and then cognition, where you have a hard time thinking, and mood symptoms like depression and anxiety. So the re-experiencing symptoms are just this. You're re-experiencing it in one way or the other. Flashbacks occur, can be triggered by something in your environment, bad dreams, nightmares, and frightening thoughts. Avoidance symptoms, staying away from places, like you might have increased stress as you drove by something that looked like a long-term care facility, or if you saw something on TV, about something you experienced, and also avoiding these thoughts because they're very uncomfortable for you. Being easily startled, like being in a store and looking over your shoulder and somebody comes up and, surprises you just by saying hi, and you really react. Or feeling just very tense, and of course the difficult sleeping, and then sometimes you get very irritable with angry outbursts. And as he said, especially if you're startled, but otherwise just during the day. So what he was talking about is trouble remembering key features of the traumatic event. You might not remember portions of what happened during the pandemic in your work. It might just kind of be blank. That's very possible and very common. Where you start to think badly about yourself, like he said, he felt guilty that he couldn't hold up his end of what he was supposed to do, and blaming yourself. And then you just start to lose interest in life, in doing things. I used to enjoy going camping, or I used to enjoy going fishing, or I used to enjoy, going here, going there, and that just doesn't occur much anymore. So the fear and the sustained trauma is due to all these things. People having to be sprayed down with Lysol when they came in the facility, or people having to change their clothes and put on something else and then change when they left, and the shortages of walking around with old PPE that had been used multiple times, or not enough PPE, and the whole stress revolving around family, and the residents' family and the residents, and just feeling overwhelmingly helpless about, as everybody did with the pandemic, but particularly in your situation. And then when are we going to reopen? And the loneliness that you visited, and the residents, always asking, when can I see my family? And the family members wanting to know, and them getting upset. And, it was just really, really, it's been, and people are still going through these things on a daily basis. So talk about self-compassion, and on our website at encounter.health, if you go to resources, if you go to providers in the tab at the top and then look down for Randy's resources, you'll see this video I did on self-compassion and long-term care. So, and the steps are, and it's a very short video, I think it would be useful for you to watch. Recognize that you're having a hard time. I mean, that's the first thing is, this is not just, a bad day. Something is going on here. I'm having a bad day. The shoulds are, I should have done this, or I should do this, or somebody else should have done this, or the government should have done that. That's really hard to sustain that level of thinking without tremendous stress. And realize, as we said before, and in the video, that there are many people going through this right now in healthcare. And you're not alone. This is not, something to blame yourself for. This is the natural consequence of what we've been going through. And the last thing that I like to tell people is, okay, let's go over the symptoms that you're having and what you've been through. And if a friend told you about this, what would you say to your friend or loved one? And that's how you should treat yourself. That's really important to realize that. What you would say to somebody else, you would comfort them, you would console them, you would offer them support. Those are the same things to offer yourself. So help is very important. Get help. We're offering a lifeline to you through Encounter Telehealth. There's counseling or therapy can help. Having social support, sharing your story with maybe peers or family members that you can trust, and be mindful. You can go on YouTube and look up breathing techniques for meditation. And these are all part of, as we were talking about, the team approach in utilizing your own skills, but also the skills of professionals to help you get through this difficult time. So if you want to speak to your primary care provider, we encourage you to do that about your concerns. And if they can maybe refer you or make a recommendation, maybe you have an employee assistance program at work, an EAP that offers several visits at no charge. And do you need medicine for psychiatry or just therapy? And that's where we're offering this visit to help you work through that. And if you have insurance, contact to see who is covered under your services. And if you want to know more, you can contact us at IHCAF staff support at Encounter Telehealth. So we provide to long-term care facilities psychotherapy and medication management, and we're here to serve you. And please email us if you think you might want to try having an appointment for a first session, just to see if there's something we can do or we can help lead you in the right direction. It's going to help you. I want to thank you for your time today, and please give us a call, see your primary care provider if you feel like you might be having some stress reactions. Please get help. You can feel better. Thank you.